Now, let's welcome Dr. Ricardo Valle, also of Novant Health Orthopedics and Spine. Dr. Valle, we are so glad to have you with us today on our show.
Thank you. Thank you for having me.
I understand that you're joining Dr. Glazer at Novant Health Orthopedics and Spine, and I know that they're excited to have you join them. So I'd like to start by learning more about you and your background. So tell me where you grew up and where you went to school.
So I was born in San Juan, Puerto Rico. Grew
Nice.
up in Puerto Rico, and did my medical school in Ponce School of Medicine. That's accredited school, which allowed me to participate in the match, and I matched in orthopedics in Albany, New York.
Wow.
Yeah, that's where I did my orthopedic residency. Then decided to do sports medicine, and I then did that in Houston.
In Houston.
Baylor College of Medicine for a year.
And you did a fellowship there?
Yep. Did my sports medicine arthroscopy fellowship there. And obviously now I'm here starting soon in Brunswick.
And we're so happy. We're so happy to have you in our very first orthopedic and spine practice. That's going to be a great, it'll be a great thing for the residents of Brunswick County, because it's going to bring that health care so much closer to home for them. So we're all very excited at Novant Health.
Me too.
So what is your particular area of focus? What do you like to do?
So sports medicine, arthroscopy, so I like to deal with injuries in athletes from pediatric high school level to collegiate level, all the way to weekend warriors, mom and dad and grandpas.
There's a lot of those
Yes.
around here, trust me. So you are comfortable with pediatrics?
Yes, for the main issues, yeah, obviously the congenital things and other issues, but when it comes to the kids who are playing baseball, little league, and soccer, and I'm happy to take care of the typical injuries that they incur.
How about total joints? Do you do total joints?
Yes, I do. That experience I've had significantly with my residency, where we did joints and reconstruction, so I had total knees and total hips. Recently specialized and did a certification, which was done in the makoplasty, which is a robotic assisted. And that's something that I think in the future may be something that can be offered. Yes, I have pretty much a wide skill in most orthopedic bread and butter procedures that I can offer the area.
Was there something that led you in the direction of orthopedics?
Like I said, I started in the youth wanting to do science. My parents were in the medical field. My mom was a psychiatrist. My dad was a family practice physician.
That's interesting.
So that kind of gravitated to that area. I went to college thinking I was going to be a cardiologist, but I then started loving surgery, the hands-on aspect of it, I went that route. And
you liked hammers and chisels and saws, right?
Yep. And the sports side of it is the history of playing sports, taekwondo, getting injured, rehabbing. So I like that area as well.
I think I heard that you had some connections here at the coast. Is that correct?
Yes, I do have family, and being from an island, I also like the coast. And the weather's a lot better than the north, at least for my skin. But yeah, I do have family in town. My wife's family, my own family, they all moved here and grew roots here already, very quickly.
And where did you most recently come from?
So I had a practice in Jacksonville.
Oh, Jacksonville, North Carolina.
Jacksonville, North Carolina, just north of us, and was there for almost 5 years.
Wow, that's pretty close to us. It's not too
Took care of the residents of Oslo County and some active duty Marines.
Oh, yeah. We talked to Dr. Glazer a bit about minimally invasive options. Is that something you also offer?
So in some aspects, yes. The arthroscopic side of things, rotator cuffs used to be done open. Now that's one of the minimally invasive procedures. During arthroscopy, we could do it through a few slits and do repair, and with ACLs also, which is your reconstruction of the ACL ligament for athletes, also is done mostly arthroscopically. So you can consider that minimally invasive compared to the traditional open.
Yeah. Well, I want to talk a little bit about your experiences in sports medicine. Tell me some of the things you've done or teams that you've worked with. I understand you have a very interesting background.
Yes, I did my fellowship in Houston, and I was lucky to follow the team physicians for the collegiate level all the way to the pro team level. So the team for the University of Houston, the Cougars, I was able to participate in practice and in their training room and evaluation of the collegiate athletes. I had a high school team, football team that I managed as well, and would follow the team physicians for the Houston Astros, the Houston Dynamos, and the Houston Texans.
Wow.
And the Houston Rockets. That was an experience. That was fun.
So, so you're interested in sports, I assume.
Yes.
You watch a lot of sports.
Yes. Growing up, I was a huge baseball fan.
Really?
Yes.
How about soccer?
Soccer, not as much.
Really?
No, but my son is good at it, so now I'm becoming a soccer fan.
Now you're a
Now I
soccer
like it.
dad, right?
Yeah, now I'm a soccer dad. So.
And you love baseball?
I do. That was my first love of sports when I was young.
Mm-hmm. So you probably really enjoy taking care of young athletes.
I do.
That'd be great. Yeah, that's great. Well, before we wrap up, can you share what you are most excited about here in joining Dr. Glazer and Novant Health Orthopedics and Spine?
Well, I'm excited to help this community, like you mentioned early on, having somebody local that they can count on, somebody that they know,
right,
be familiar with, be somebody dependent on, be able to take care of your kids, to take care of the parents as well as the grandparents, and be able to take care of the whole family.
Right. Well, that is great information, and I'm so happy that you're here. Novant Health is just thrilled that you've joined us. And if you could share with our viewers how they might reach you. I know you have a website, and they can go to My Chart, and then we'll run the phone number along the bottom of the screen where they might make appointments. And I assume you're taking new appointments.
We're taking new appointments.
And do you need a referral to see you?
Most patients can call their physicians and get a referral, or can call our office and we can help them with that.
That'd be great. Well, thank you again for being here today. I look forward to having you back, and we can talk about some of those sports things we're talking about.
Absolutely. Thank you for having me.
You're welcome.